For June 2022 is just a few days away. Don't panic. In this video, we're going to be looking at things you can do to best utilize your time in order to maximize your chances of passing the MDCN exam. Hello, I'm Dr. Mariam and welcome to my channel where I make videos to help junior doctors navigate easily through the medical system. So if you're new here, give me a subscribe. So first and foremost, for you to get the most out of this video, I made two videos before this. One is on the MDCN exam itself, where I talk about the format of the exam, the eligibility criteria for registration, the documents needed for registration, and the cost of the exam. The other video is about what to study for the exam and how best to prepare. So make sure you pause this video, go watch those two videos, and then come back to this. So before we start, if you're one of those people who have not taken this process seriously and you really have not studied your best and you're looking for a quick magic fix to passing this exam, this video is definitely not for you.
Leave my video.
Let's be honest, the MDCN exam has its issues, but people have their issues as well. I'm here to help guide those who have genuinely studied their best and are looking for ways to utilize their last few days before the exam. So let's start. The exam is about a week away, and the first thing I recommend you do is form a study group. A study group is indispensable for passing the MDCN exam. I do not recommend anyone to spend these last few days studying alone. Try to form a study group of not less than 6 people and not more than 10 people, because if it's overcrowded, you're not really going to gain much. And try to get serious people in that study group, because at this point, you're trying to learn from them as much as they're trying to learn from you. It won't be really fair, and honestly, it will be kind of a waste of a time if you get people that are benefiting more from you than you are from them, because you're all trying to pass this exam. Try to meet daily, and what you're trying to do is practice the following. So your physical examinations, your clerking or history taking, your counseling, your levels of prevention, and your 10 symptoms. Boom, that's 5 stations right there for your OSCE. Actually, let's make it 6 because you usually have 2 or more physical examination stations. So try to practice with your study group and try to simulate the exam. So make it in an exam scenario and get a timer to time you. Try to aim for between 3 to 4 minutes because the exam itself is 5 minutes and you might want to finish everything before time. So try to time yourself between 3 to 4 minutes for each of the stations. For the physical examination, your girl has got you. I have physical exam videos tailored specifically for the MDCN exam, so I'll link it in the description. Make sure you watch them, can binge watch them a night before your exam so that you can refresh everything in your mind. Unfortunately, I do not have videos for counseling and clerking yet because it's a lot. I script my videos myself, I film them myself, I edit them myself. It's a lot of work. So unfortunately, the exam is just a few days away and I did not have time to make videos on clerking and counseling, but inshallah I will have them before the November exam. I'm praying that if you're watching this video and you're writing the exam in a few days, you will not need these by November, if you catch my drift. For the MDCN OSCE, you cannot go into that examination without knowing your physical exams because you will have at least 1 station, if not 2 or 3 stations on physical examinations. So make sure you practice your physical examinations. Another thing you cannot go into the exam without knowing, obviously, are your clerking, your counseling, your levels of prevention, your 10 symptoms. They always come out. And then some basic data interpretation like the full blood count, especially like in regards to anemia. You have to know your pattern. So you have to know the HB, the MCV, the MCH, you have to know that, and then know the patterns of microcytic, normocytic, macrocytic anemia. You also have to know interpretation of EUCR, basic LFTs, so your conjugated, non-conjugated. You might get a case of jaundice and they might ask you to interpret based on the LFTs, whether it's pre-hepatic, hepatic, or post-hepatic, and might ask you for a likely cause. Also know your basic ABG interpretation and basic ECG patterns. And you need to know your immunization schedule as well, so that's specifically for pediatrics. The second thing you're going to do is you're going to go through your pictures. So these are the ones behind the guide, at the back of the guide, and then in pediatrics in pictures. So for each picture, try to know the name of what you're looking at and the indications. For example, here we're looking at the guide O1G and we're looking at a Cusco speculum. So for example, you need to know this is a Cusco speculum, this is how it looks like, and what's the difference between it and the gray speculum, which is basically the size of the posterior blade and how equal it is to the anterior. So you need to know noticing small details like this, and then, like I said, know the indication. So for example, they might ask you, what instrument is this, and list 3 uses in clinical practice. So at this point, we've covered what you need to do to prepare for the MDCN OSCE and what you need to do to prepare for the picture test. And you'll notice that I have not mentioned anything about the MCQs, and that's because the CBT, well, really is on you. What you know is what you know, because it heavily relies on your background knowledge. You do not need to read broad. So if you watch my other MDCN guide videos, you'll know that I recommend reinforcement and supplementation. So meaning by the time you're writing your MDCN exam, you've graduated medical school and most of the information is really in your head. It's just about reinforcement. So just go through your uni lectures, what you were taught. It will be easier to revise, and then supplementation with the guide or rule of thumb or synopsis. By this time, you really should have finished studying for your CBT, and your guide should probably look like this. So you finished studying most of the topics, it's just revising that you need to do. Honestly and personally, this is my own personal opinion, I would not recommend anybody to use these last few days to be going through theory. They're trying to learn new topics, because what new thing can you learn at this point? You just have to revise and pray to God that what you read comes out. So for the next part, brace yourselves, okay? The questions for the CBT are kind of funny. What I mean is, they're not really straightforward. For normal questions in any standard exam, you read the question, you'll understand the question, and then the difficult part is knowing the answer or not. But for the MDCN exam, the question itself needs understanding. I think it's best explained through an example. So for any standard exam, the question might look like this. A 25-year-old woman comes to you with 3 months history of diarrhea, absent periods, and uncontrollable weight loss. Which of the following will not be helpful in aiding your diagnosis? A. TSH. B. Anti-TPO antibodies. C. Ultrasound. D. Scintigraphy. E. CEA. Pretty basic, right? It's either you know the answer or you don't know the answer, which in this case, she has some form of thyroid problem and you need to get to the answer. But for the MDCN exam, the question will probably look like this. A 25-year-old woman comes to you with 3 months history of diarrhea, absent periods, and uncontrollable weight loss. In regards to her diagnosis, A. TSH. B. Anti-TPO antibodies. C. Ultrasound. D. Scintigraphy. E. CEA. Do you see what I mean? If you contrast this question to the other question, there's an obvious difference. That question is much more straightforward. You already know what you're doing. You're looking for the one that's not going to aid your diagnosis, and they've made that clear. But for this one, and this happens a lot in the CBT, you read a question and you're not actually sure what they're looking for. Are they looking for the correct answer or the wrong answer? You don't know. So some of these questions, you just have to read them twice and read the option twice. And then for the picture test, again, some of the pictures might not be clear, so make sure you take your time, because sometimes the pictures are not really clear. Some vital information may not be seen, so make sure you take your time and look at the pictures. Basically, don't go into this exam on an empty stomach. Also, try to answer all of the questions, because as far as we know, there's no negative marking for the MCQs and the picture tests. So another thing you might want to do before your exam is check up on the latest news and the latest trends, any epidemics, pandemics. So for example, recently there's been an outbreak of monkeypox around the world, so that might be relevant for your examination as of the time of recording of this video, which is May 29th, 2022, I think. Next, this might sound like common sense, but apparently common sense is not that common. During the exam, please and please try to avoid malpractice. Do not cheat, do not discuss, and do not do long neck. Like, the last thing you want is to be disqualified from the exam or fail the exam over something as unprofessional as malpractice. Lastly, during the exam, your dressing and your attitude, basically how you carry yourself, matters. These people are looking for anything they can use against you, and if you fail, nobody will ask why. So just try to not give them any reason to doubt or question you, or to give them any reason that might make them feel like they want to fail you. So when you're dressing for the exam, try to dress smart. Don't wear slippers. Try to cut your hair if you're a guy. No nail polish or like fake nails if you're a female, and then no hair dye. Like, all of this is just common sense. You're going into a professional exam and you need to behave in a professional manner. Remember, first impressions matter. When you get to your station, remember to greet your examiner, be polite, and be humble. In caps. If you have an accent, try to dial it down, because they might not be understanding what you're saying, or they might think that you're forcing it and that might annoy them. So just try to speak in a way that they will understand. Like, speak normally. Don't argue with your examiner and leave your station when it's time to leave. Like, be respectful of the other candidates. So that's all I have for you guys for now. Don't stress, inshallah you will pass. Believe in yourself, be confident, get lots of rest, and then don't forget to make prayers, because at the end of the day, no matter what you do, it's God that can save you. Make sure to watch the other MDCN guide videos. They will be really helpful to you for the exam. Don't forget to subscribe. Thank you for watching. Share with other candidates as well, and all the best.